So it's time for you to choose between a lumpectomy or a mastectomy. Let's talk about it.
You're never told that life could ever get this way.
First of all, we need to know the difference between a lumpectomy and a mastectomy. A lumpectomy is a breast conserving type of surgery. They're going to try to conserve as much of the breast as possible while still removing the tumor. They tend to remove the tumor and about 1 centimeter of tissue around it. A mastectomy is more complicated. If you choose a mastectomy and you do not choose reconstruction later on, then the goal is going to be hopefully an aesthetic flat closure, and you can wear a prosthesis on the side that you had a mastectomy, or if you asked for a double mastectomy, you have aesthetic flat closure and symmetry. You can still wear a prosthesis if you would like, but you can also remain flat and you still have that symmetry. With a mastectomy, a lot of times people choose that over a lumpectomy for further disease prevention. I know, the choice can be overwhelming. Many of us weren't even thinking about this topic at all until we got a breast cancer diagnosis. So here's a little history of mastectomies. If you were diagnosed and treated in the 70s or earlier, you didn't have any other options other than a mastectomy. But the good news was that the chance of recurrence was usually only 5% or less. At around 1976 or so, that's when they introduced the lumpectomy with the goal of less volume loss, so that you could have symmetry with the remaining breast. But the problem was that the chance of recurrence was about 40% at that time with a lumpectomy. So they worked to figure out what they could do to help reduce the risk of recurrence when choosing a lumpectomy. And they found out the whole breast radiation helped to sterilize any potential cancer cells that may have been left behind. And that risk of recurrence went from 40% down to 10%. This still allowed for a mastectomy further down the road if there was a recurrence, but it also brought the risk of recurrence down to the same amount as if they had a mastectomy, which was 10%. That data is over 20 years old, and since then, systemic therapies have improved, but it still means that if you get a lumpectomy, you're most likely going to still need whole breast radiation. Now, if you do choose a mastectomy, like I did, I still need to remind you that the risk of recurrence is not 0% just because you removed both breasts. It can come back in the area that you had a mastectomy or come back anywhere in your body, but the risk is still very low. Now let's talk recovery time. With a mastectomy, most likely you will have an overnight stay, although there is an upward trend of more and more patients coming home the same day. With a lumpectomy, it's mostly an in and out procedure, which means that you most likely will come home the same day. Also, with a lumpectomy, you will probably be back to being able to go to work and do your normal tasks in 3 to 5 days. If you have a mastectomy, however, it may take from 4 to 6 weeks for you to be back to your normal tasks and going back to work. At the time of recording this video, most surgeons say that lymph node involvement is unrelated to whether you choose a mastectomy or a lumpectomy. But if lymph nodes are determined to be invasive or involved, then it will be suggested that you have your lymph nodes looked at, that you will have them sampled or biopsied so that they can look at them more. Everybody's journey is different. I had a sentinel node checked prior to anything that happened prior to any care plan being written up. And they determined my sentinel node was positive for breast cancer. So that changed my whole care plan. And it involved neoadjuvant chemo, which means that I had chemotherapy prior to my mastectomy, my breast surgery. And that shrank not only the tumor, but it removed a majority of any traces of cancer from my armpit area. It was on this side, from my armpit area. But I still had to have radiation because there were traces of cancer, minute traces, but traces of cancer found in the lymph nodes. If you have a sentinel node biopsy come back positive, chances may be that they're going to usually remove all of your lymph nodes. But if you have a lymph node biopsy prior to surgery or any care plan, and it comes back negative, they may check during surgery. In the 1970s and before then, when they did a mastectomy, they removed everything. And I mean everything. I mean the pectoral muscle as well. But in more recent years, I'm about 10 years out almost, and they leave the pectoral muscle behind in most cases. But I am going to leave you a heads up that you probably won't have much sensation at all in the area that had surgery. You will have little to no sensation. It's a really strange thing because it's numb over here, but shortly after my mastectomy, I had itchiness over the numbing. That itchiness was a sign of healing, which is good, but it was really strange because it was on top of a numb area, which is strange. But I just wanted to give you that precaution that the choice ultimately has to be yours, because I do understand why people choose a mastectomy over a lumpectomy and why they choose a lumpectomy over a mastectomy. We're going to talk about some more pros and cons to weigh. Now let's talk drains. If you have a lumpectomy, you don't have to worry about this, most likely. But if you have a mastectomy, you're probably going to have drains left in place for an average of 5 to 7 days. They may be removed before then, or it may be after. Everybody's case is unique to them. But it will be sewn into your skin by the chest wall, and it is there to help drain lymphatic fluid and blood, any other bodily fluids that might be coming out of your surgical site. Those will stay in place until your surgeon determines that they are allowed to come out. They can be a little bit uncomfortable in my personal experience, but they're not so uncomfortable that they're unbearable. That's in my personal experience. Everyone is different, but most people do say that it is not that big of a deal compared to a lot of other things they've had to endure. I will talk about the threshold of fluids that they usually use to determine when the drains can come out in another video when I talk about surgery recovery from a mastectomy. Let's talk more surgery. This is the main reason that I chose a mastectomy over a lumpectomy, because the possibility of needing additional surgery is higher with a lumpectomy. Because with a lumpectomy, they usually remove the tumor and then about 1 centimeter around the tumor. They will send that to pathology, and if there are cancer cells too close to the edge of that margin that's surrounding the tumor tissue, they're going to want to go back in and remove even more tissue. So this is why a lot of people choose a mastectomy over a lumpectomy, because they don't want to have to go back and do this again. Now let's talk about your body shape after surgery. With a lumpectomy, the chances of your body shape changing your overall appearance are lower. With a mastectomy, it can be more drastic. Now I say that with a grain of salt though, because with a mastectomy, you can choose aesthetic flat closure, Also, in that time period between your surgery and reconstruction, if you choose reconstruction, they do have prosthetics available for you. A lot of times insurance will cover that. If it doesn't, you can also reach out to Knitted Knockers. I will put their link below in the description of this video. And that organization is full of volunteers that love knitting for a cause. They will knit a prosthetic for you. They will even knit it with a collar of yarn that is similar to your skin tone. And this can help even out your the difference between what you may have left behind and your surgical site. And also this is a seed for another video when I talk about reconstructive options. I'll talk about that at another time, but if you do choose reconstructive surgery, there is some time, it can be a big window. Sometimes you get reconstruction right with your surgery, and sometimes you have to wait for your reconstruction. Like I said, everybody is different. It's not one size fits all for every pink sister, every breast cancer survivor. But there are a lot more options than there were back in the 70s and even in the last decade or so. Reconstructive options. So being uneven is a temporary thing for a lot of us, or you can choose to go completely flat. And also I have found some groups and pages on Facebook and elsewhere that talk about fashion for people that have had a mastectomy, so that disfigurement, they don't feel it as much, and they can feel just as attractive, if not more so, because we can embrace our scars and embrace what we have overcome. There are places where you can get some fashion tips to help with that situation, and I will try to leave those links below. A lot of the things that will help you determine whether a lumpectomy is right for you or a mastectomy is right for you are psychological. If you choose a lumpectomy, you may be wondering if those margins are going to be clear. Definitely, you're probably going to be wondering that. If you have gone through a lot of active breast cancer treatment like chemotherapy and any kind of active breast cancer treatment prior to surgery, it can be exhausting. And so the thought of an additional surgery in addition to the original breast surgery can be overwhelming. So that's the reason that many breast cancer survivors do choose a mastectomy over a lumpectomy. A lot of people wonder if there might be something lurking there that was not picked up by imaging, which is a valid concern, because when my pathology came back, they did not pick up lobular carcinoma. They only picked up the ductal carcinoma. They were unaware of lobular carcinoma. Even though it was lobular carcinoma in situ, it was still cancer that was not picked up with any imaging. So that is a valid concern. And then on the other end, if you pick a mastectomy, you may be concerned with disfigurement. And I just talked about that earlier, but you do have to weigh that for yourself, for your choice, whether a lumpectomy or mastectomy is right. But those are some psychological things that may be something that you have to grapple with and wrestle with to come to the choice that is right for you personally. Another thing that you're going to want to consider prior to your surgery is if you have a genetic mutation. Now, most breast cancers are environmental and are not genetic, but if your breast cancer ends up being genetic, they're most likely going to suggest that you choose a mastectomy over a lumpectomy, and that needs to be done prior to surgery. If you are a lower stage breast cancer patient, you are more likely to be a candidate for a lumpectomy, but you will still probably have to have radiation after your lumpectomy. If you are a lower stage breast cancer patient and you choose a mastectomy, the likelihood that you are going to need radiation is much lower. Now, if you are a lower stage, lumpectomy may not even be an option. And with a mastectomy, whether or not you need radiation will depend on that lymph node involvement. Like I said earlier with my personal journey, I had a mastectomy. They did not know if I would need radiation until after they got the pathology back. For my case personally, which may be different than yours, I was stage 3 and they did the mastectomy. They sent that tissue from that mastectomy, they sent it to pathology. And not just the tissue from the breast area, but also the arm. They removed all 11 lymph nodes. That's what I had, and everybody has different numbers of lymph nodes, but I had 11. They removed all of them, and 4 of them came back with minute traces of cancer. So I went ahead and had to have 30 rounds of radiation. It may be different for you, but the stage of your breast cancer can sometimes determine whether you're a candidate for a lumpectomy versus a mastectomy, and also what you might have to expect after surgery. One of the reasons that I say that the choice between a lumpectomy and a mastectomy largely depends on you personally is because every pink sister, every breast cancer survivor is different. And there are 3 factors that make us different in our decision process. One is going to be how old we are. One is going to be the size of our breasts that we had coming into breast cancer. And one is going to be health conditions. And all 3 of those factors play into how we might personally decide between a lumpectomy or a mastectomy. Let me explain how age plays a role in the decision you make personally, if both a lumpectomy and a mastectomy are options for you. If you're younger, you may be concerned about longevity and quantity of life a little bit more, because you may have children to stick around for, and so you're wanting to have fewer needs for additional surgery as much as you can control that. But also on the other side of the coin, if you're younger, you may be more concerned about your figure, and you might be worried about disfigurement. But that's up to you personally, because it may depend, you personally may or may not have children, or you personally may or may not have that body confidence or lack of it. If you're older, you may not care anymore about what you look like because you just value other things in a different way. You may also be more concerned with quality of life over quantity of life. And that can play a role in a lot of different things, not just in your surgery choice, but in other choices in your breast cancer journey. So age definitely is a factor that can make this a very individual, unique, personal choice. Breast size also plays a role. It's another factor that makes this a very unique personal decision for you. If you already have a small breast, a lumpectomy might not really feel like a lumpectomy anyway. It might feel more like a mastectomy. You might decide, well, just take it all anyway because I don't have a lot of tissue for you to work with as it is. Versus if you have a large breast, it may be hard for radiation to get to where it needs to go, but on the other side of the coin, you have more tissue to work with, so a lumpectomy might be a higher likelihood for conservation because you have more tissue for the surgeons to work with. Health conditions can also play a role in how you decide upon a lumpectomy or a mastectomy. For example, if you have a heart condition and you want to avoid radiation, and you are an earlier stage patient, you may choose to go ahead and go with the mastectomy because the likelihood of needing radiation is lower, and radiation can elevate your risk with a heart disease. You would have to talk to your doctor about that. Can you see now why the surgery choice alone is something that is very, very unique to your personal life, and it has to be your personal life, your personal choice that comes into play with deciding between a lumpectomy or a mastectomy if they are both on the table. And I pray that you don't let anybody push you into one choice or another, and that you consider all of the factors and all of the considerations that I've mentioned in here. There may be more. If there are more considerations and factors, please feel free to share them below in the comments. But at the end of the day, it really depends on you and what you want for your surgery choice, a lumpectomy or a mastectomy. Like I've said in several of the prior videos, and I'll probably continue to say in future videos, this really isn't a cookie cutter approach. How your care plan unfolds should depend on your personal life and certain factors that are personal to you.
You're never told that life could ever get this way. This bill's a joke, you're broke, your love life's still wait. This journey feels like you're in second gear.